Hello, my name is Cameron Sabat, and this is Cutting to the Case with Claire Gill, CEO of the Bone Health and Osteoporosis Foundation and founder of the National Menopause Foundation. With more than 25 years in nonprofit leadership and communications, she's shaped national policy on bone health, advanced awareness campaigns on women's health, and built organizations that give voice to issues long overlooked in medicine and public health. Thank you so much for joining us.
Thanks so much for inviting me. I'm so excited to talk with you.
Yes. So I wanted to start out with how you began in all of this. So what drew you from kind of into women's health leadership and in bone health leadership, and what keeps you motivated in this mission?
The motivation is the super easy part. What drew me in actually was I had spent the early part of my career in nonprofit, and then I went into the business side, working in public relations for several PR agencies. And I was working on a potential partnership between one of my clients and what was the National Osteoporosis Foundation, and going through a career change and got involved with the National Osteoporosis Foundation, and I thought, oh, I'll do this for a year while I transition out of my partnership, and I never left. Well, that's not true. I left very briefly in 2019 and founded the National Menopause Foundation, as you said, and then they had a leadership change and asked me to come back. And what keeps me motivated is the more I learn about our health in general and our health system, the more I'm passionate about improving it and finding ways to provide better care for people and better education for all of us about how do we stay healthy and how do we age healthfully.
Absolutely. And really not a lot of info about bone health or menopause makes it into medical training, yet they affect millions. Why should young clinicians and researchers consider focusing on bone and women's health as they build their careers?
It is so critical. And I am so grateful to you and all of your colleagues for going into medicine because we're going to have a real crisis in the United States of not having people trained to be able to take care of us. And I say to people all the time, my fear is that there's going to be no one available to take care of me in my old age. And so that's why it's so critical that some of you consider this as your career path. But it's also really exciting. It is an opportunity as we're living longer to really get into the areas of medicine that have the biggest impact on a huge portion of the population. So if you're talking about women's health, we're talking about over half the population of the United States. And when we talk about the menopausal aspect of that, while not all women will become moms or go through the reproductive part of having a child, all women are going to experience menopause. And so it really is a huge portion of the population that you can have a direct impact on the quality of life and being able to prevent some of the chronic diseases that happen to women as we lose estrogen in our bodies and then move into our older years. And on the osteoporosis side, on the bone health side, that's really from birth to grave, right? We build all the bone we're going to get by our mid 20s. And then the rest of our lives, it's breaking down and building up and breaking down and building up. And so, again, it's fascinating to me. And I hope it's fascinating to you as you study medicine and the human body. What do we do to protect that skeleton and how important it is to protect our organs, to protect our functionality, and again, to keep us going through, our lifespan, which is getting longer and longer. We want to make that healthy lifespan.
Yeah, and that kind of mirrors the broader approach from moving from lifespan to health span. I think that's an important dichotomy to feature here. And one in two women and about one in four men over 50 will break a bone due to osteoporosis. Why hasn't that staggering stat broken through in public health like cancer or heart disease?
I have absolutely no idea. And as a public relations person by background, I've been trying to figure that out. Not only is that statistic frightening, but when you think about those fractures, of the 300,000 hip fractures that happen in the United States every year, 25% will be dead within the first year. That is outrageous.
It's
And
awful.
25% will never go home again. They'll either be sent to assisted living or a nursing home, and the remainder will have to use an ambulatory device for the rest of their lives. So I'm really stunned too, and I don't understand, Carmen, why we're not focusing on bone health more and not trying to do something about this crisis that we have.
Extremely important. Yeah. And really, what was the turning point where you knew silence had to end around, launching a foundation around menopause, a topic that's often avoided or taboo?
Yeah, well, I think I was approaching that stage of life myself when it came up to me, but it was actually pointed out to me because someone approached us at the Bone Health and Osteoporosis Foundation and said they needed to do a continuing medical education program, but they needed a consumer audience to provide input. And there was no patient advocacy organization for menopause. And we all just stopped and looked at each other. And I was like, that can't be true. And so it was true. And so for me, that was that moment where I was like, I have, again, like I said, spent half of my career in nonprofit, half in business and for profit, and realized there are huge gaps like that when it comes to things within the nonprofit and certainly in the health space, where again, half the population is going to experience this and there's no basic education about it. It really was shocking to me. So that's what got me into it. And I'm so delighted that so many other organizations and so many other people are talking about it now. And yeah, it's about time. And I think it's, again, as you mentioned, though, that health span, as we're living longer and realizing, oh, wait, we've got a lot of living to do. And what do we do at this stage of life? And how do we understand what's happening to our bodies at this stage of life? And I think for you all in medical school, I mean, I'm told for both, for osteoporosis and menopause, everyone has told me there's about 4 slides in all of medical school that talk about these things. That's outrageous. And so I really encourage you, if you're not getting it in medical school, to seek it out elsewhere because your patients and your clients are going to need it.
Absolutely. Yes. Yes. And, you know, zooming out into the policy perspective, if you had 5 minutes with CMS or a major insurer, what's one bone health policy change you'd fight for immediately? Because we,
Well,
we we do have some of those people subscribe to this podcast. So
Well, that's wonderful. And I talked to them, and I've been talking to them a lot over the last several years. The immediate thing that we have more than 30 organizations in the health field agreeing on is that we need a reimbursement model for post-fracture care. So there's about an 80% care gap when people break a bone due to osteoporosis and get no follow-up care. So we've tried to make the equivalency of like heart attacks. You would never go into the emergency room with a heart attack and leave without getting an aspirin, a beta blocker, a follow up with a cardiologist. Yet everybody almost who breaks a bone is patched up their bone and sent home without any discussion. And again, we're talking about those over 50, as you mentioned that statistic,
Mhm.
are sent home with no follow up care, no referral for a bone density test, none of it. And part of that is because that time it takes to get someone out after their fracture, but yet get them all the screening and all the things that need to be done to evaluate and PT and et cetera, vitamin D tests to determine their osteoporosis, their chronic disease management is not able to be reimbursed under current codes. So that's what we've been working with, and very, very hopeful that CMS will be putting in a new G code that will address this very soon.
Wow. Yes. Preventative medicine as well. And really that kind of speaks to the broader inequities within medical care as well. Osteoporosis and menopause obviously don't affect everyone equally. What inequities do you see most clearly, and how are you working to change them?
Well, in general, again, that just women's health versus men's health and how it has been disproportionately studied and funded in research. But
Mhm.
within the women's health in general, it's also very different how different ethnicities experience and go through menopause and what symptoms they have and for how long they have them. And also when they're able to get care and access care. And that's also true in the bone side for both men and women, whether or not you're in rural communities or whether or not you're in a medical hub, the variance in the type of care you might get is huge. But also for both of these conditions, because no one owns it. So with osteoporosis, you can be seen by a primary care, an internal medicine, family medicine, gynecologist, rheumatologist, endocrinologist, geriatrician, and obviously the orthopedist who fixes the broken bone. None of them, though, is follow up and osteoporosis care their primary focus. So again, it slips through the crack. And on menopause, the same thing. Once we get past our reproductive thing for an OB, the gynecology part, the continuing part, doesn't make the money that the surgery and delivering babies does, and no one owns that care. So again, huge opportunity for those of you who are studying medicine to make it your focus, and really will have absolutely no shortage of patients coming to see you.
Yes, yes, yes. And really that kind of expands to uh expanded access to care. And that kind of crosses very well with technology and innovation. Where do you see AI, wearables, or digital health making the biggest difference in preventing fractures or supporting women through menopause?
I think there's so many great opportunities to use AI effectively, particularly when we look at some of the things that take up a lot of time on the back end stuff versus the, yes, technology for wearables. And there's some new ones that are coming to the market in bone, which have been FDA approved that, again, for people with osteopenia can help prevent the onset of full blown osteoporosis, and that's certainly very very important. But on the AI side, being able to manage that care and track those patients so they don't get lost within the system, and being able to communicate on that ongoing pathway of care is going to be very very important. And so
Mhm.
much of that we can use AI to help identify and adjust the who needs to be seen, how fast do they need to be seen, what are the highest fracture risk patients based on criteria that is input into the AI system. All of these are things that I look forward to seeing come to fruition and be able to help us to manage, our older population.
Absolutely. And what is the toughest leadership decision you faced as CEO, and what did it teach you about leading in those health nonprofits?
I think the toughest uh, issue I face is the breadth of the audience that we're trying to reach. And we're trying to reach and bone 54 million Americans who are impacted by osteoporosis or low bone density, and we're trying to prevent those fractures for them. And as I mentioned earlier, all those clinical groups that serve them and treat them, we're also trying to reach them. And the same on menopause, where there's been no education for women for decades about what happens to their bodies and what to expect during this transition, and no clinicians available to treat them. So I feel like even when we know who to treat, how to treat, what to treat with, everything is in place. The frustration is trying to be able to get that common sense reimbursement code so we can move forward and make advances, right? Or being able to get medical students and post, and doctors already in the field to be up to date on what we now know about hormone therapy versus what we knew 20 years ago with the Women's Health Initiative, right? Those are hurdles that are frustrating to me as a CEO because there's so much time and energy put into something that could be a very easy common sense fix if we just had a unified voice in describing the situation and the need.
Mhm. Absolutely. And really, I want to be mindful of your time as well. Final question. Are there any international models of bone or women's healthcare that the US should be paying attention to right now?
Yes, I think many countries have the fracture liaison service or post fracture care pathway already put in place in their country. And I fully recognize that when you have a national health system, that is far easier to do. But when we look at that and we have all of the data to show that it works and that it can be done, it's again, how do we implement that and how do we get that going in the United States? And I think that's going to be very, very critical. I think all countries are struggling with how do we advance women's health, and how do we learn and fund the research for things that we still do not know, because there are more questions than there are answers in women's health at this stage. And in 2025, that's sad.
Absolutely. Thank you so much for sharing that. And thank you for joining Cutting to the Case.
Thanks so much for having me.
Thank you so much. And to all our viewers, feel free to search up the National Menopause Foundation. I mean, the work Miss Claire Gill is doing is absolutely fascinating and important. And I wish you the best on moving forward.
Same here. Thank you.
Thank you. And this is Cameron Sabat from Cutting to the Case, signing off.